The Ministry of Health says in recent weeks there has been a dramatic increase in cases of gastroenteritis. Patients will experience severe vomiting, diarrhea, and sometimes fever. Dr. Sharon Belmont George is the medical officer of health.
Our analysis from our epidemiological week 9, we noted increased number of cases of gastroenteritis in children below the age of 5 and also in adults as well. We are particularly concerned about the risk ages, for example, persons less than 5 and the elderly, that is persons greater than 65 years of age, because they are susceptible to the complications of gastroenteritis, which include dehydration. So we've noted the increase in quite a few of our health facilities around the island, and we want persons to be vigilant in terms of observing their children and also the elderly, who are more susceptible when they develop cases of vomiting and of diarrhea. And we also want persons to improve on their hygienic measures that they can take to prevent gastroenteritis at home and also at school.
Dr. George urges the public to ensure that hands are washed before eating, handling food, and after using the bathroom.
So we want persons to be very vigilant as to where they eat and what they eat. For example, if you're drinking water, the source of the water. We usually encourage persons to boil their water at home, and we are also asking persons to be careful in terms of food preparation, where food is stored, how food is stored. Our laboratory tests so far have confirmed that it's a viral origin, that is the rotavirus has been isolated. So we want, for example, we want persons as well in terms of regular hand washing for children, like at schools, at preschools, for the teachers and the schools as well, to be vigilant of children who have signs and symptoms of gastroenteritis.
And still with health matters, Commerce and Consumer Affairs Minister Emma Hippolyte has made a plea for better lifestyle choices among the population. The call was made as St. Lucia joined in on the international observance of World Consumer Rights Day under the theme Healthy Diets. Unhealthy diets, she reminded, are linked to the main causes of death worldwide,
namely obesity, high blood pressure, high blood glucose, and high cholesterol. Obesity alone is estimated to cost globally some US $2 trillion per year. Accordingly, Consumers International, the world's federation of consumer rights groups, with over 250 members, spanning some 123 countries, highlights that it is time the world woke up to the price of unhealthy diets. This is why Consumers International has decided to make healthy diets this world's theme in observance of World Consumer Rights Day 2015.
Non-chronic communicable diseases, she noted, remain a challenge, with obesity in children increasing rapidly.
A survey in 2007 conducted by Canadian researchers found St. Lucia to have the highest rate of diabetes in the world and the second highest rate of diabetes-related amputations in the Caribbean. An analysis of our hospital data for the period 2007 to 2009 showed that diabetes and hypertension accounted for 27% of all hospital admissions. Of these admissions, hypertension accounted for 50%, with a total of 2,868 people. Diabetes accounted for 27%, a total of 1,564 people. And persons with both diabetes and hypertension accounted for 23%, a total of 1,275 people.
The onus, the minister pointed out, is on individuals to make better choices in food consumption and lifestyles.